कम्युनिटी फार्मेसी प्रैक्टिस क्या है इसका डेफिनेशन पढ़ेंगे. Definition: Community pharmacy is a branch of pharmacy that deals directly with people in the local area. It has responsibilities including compounding, counseling, checking, and dispensing of prescription drugs to the patient with care, accuracy, and legality. A community pharmacy involves appropriate procurement, storage, dispensing, and documentation of medicine. It is an important branch of the pharmacy profession and involves a registered pharmacist with education, skills, and competence to deliver to professional service to the community. The community pharmacists are considered to be the most accessible health professional to the public as they are available to provide personalized advice about health and medicine on a walk-in basis without the need for an appointment. अब हम लोग जानेंगे हिस्ट्री और डेवलपमेंट के बारे में कम्युनिटी फार्मेसी का. History of drugstore is as old as human development, where man acclimates the specialty of recuperating health through cool water, a leaf, and soil or mud. Middle Easterners were the primary who began proficient drugstore setups. The primary ever seeded store in the worldwide were built up in Baghdad in 1754. The Middle Easterners sought right around 2,000 substances. Even some of them are still being used to this date. The preparatory type of drugstore spread later to Egypt, antiquated China, and furthermore to the Europe. In 1683, Benjamin Franklin was primary who precluded doctors from planning solution by contracting the principal drug specialist in Pennsylvania. Doctors Facility America, and this was the initial move towards the advance in the field of drugstore. The immediate patient care association by drug specialists began in mid 19th century in America. In 1999, categorized pharmaceutical care as capable arrangement of medication treatment to accomplish an equivocal positive result that enhance the patient's personal satisfaction. The definition gave another perspective to the part of obligation of drug specialist. The looks of community pharmacy showed up is in subcontinent, that is Pakistan, Bangladesh, and India. In 1863, when Sheikh Nabi Bucks began a general store with a drugstore, proficient drugstore instruction began in the subcontinent when a formal preparing began in Bengal, trailed by an entire drugstore program, which was prolonged for 3 years in Banaras Hindu College in 1937. इंटरनेशनल एंड इंडियन सिनेरियो क्या है फार्मेसी में. Existing scenario of dispensing practices at community pharmacy in developing countries. In developing countries, due to lack of qualified personnel, direct access to pharmacists in all the areas is not possible. Thus, the quality of pharmaceutical services in a given region becomes dependent on the availability of a pharmacist. It is well-known fact that the conditions of pharmacy practice differ among countries and also vary between different areas within the same country. This is due to the number of pharmacists being lesser, that the direct supervision of pharmaceutical products by the pharmacist can be beneficial in ensuring the provision of high quality services to the patients. Many dispensing workflow procedures are not consistently followed by all pharmacy employees. Poor dispensing practices are manifested by errors occurring in the transcription stage, incomplete dispensing, lack of proper counseling about drugs. So drugs are not being labeled and different drugs being mixed in the same package. Drug sellers often fail to adequately counsel their customers in certain setting and no counseling is provided at all. Customers are rarely informed about the precautionary measures and adverse effect of the drug. Thus, pharmacies are being underutilized with respect to their capacity to deliver health promotion advice. Majority of customers visiting pharmacies seek care for fever, pains, and diarrhea. Other conditions for which customers seek care at pharmacies and drug stores include loss of appetite, dyspepsia, rashes, wounds, hookworm infestation, emergency, contraception, STD, skin infection, scabies, eye and ear. The quality of case management in the retail sector leaves much more room for improvement and depend on the knowledge and manner in private drug seller treat their customers. Thanks for watching.